No one truly knows what the next pandemic will bring. Will it be another coronavirus variant, an ancient virus thawed from ice, or something completely unknown, an alien infection or zombie-like outbreak? We can only imagine. But the next real pandemic may not come from space or the past. It's already here, silently growing among us. It doesn't spread through coughs or sneezes, but through something we all rely on: antibiotics. This invisible, slow-moving crisis is called antimicrobial resistance, or AMR. Antimicrobial resistance occurs when bacteria, viruses, fungi, or parasites develop the ability to survive drugs that once killed them. The most concerning form is antibiotic resistance, when bacterial infections no longer respond to standard treatments. Imagine a world where a small cut, a simple throat infection, or routine pneumonia could become deadly because antibiotics no longer work. Globally, AMR was responsible for 1.27 million deaths in 2019, contributing to nearly 5 million more, according to the Lancet 2022. Experts warn that by 2050, AMR could kill 10 million people per year, surpassing cancer. Children are particularly vulnerable. In 2022, over 3 million children worldwide died due to infections that no longer respond to antibiotics. UNICEF 2022. The physiology of resistance explains why this happens. When antibiotics are used, most bacteria die, but a few survive due to tiny genetic mutations. These survivors multiply and pass on their resistant traits. Bacteria can also share resistance genes with other bacteria through horizontal gene transfer, using plasmids or mobile DNA elements. Some bacteria produce enzymes like beta-lactamases or carbapenemases, which destroy antibiotics before they can act. Others use efflux pumps to expel the drugs or alter their membranes to block drug entry. A notorious example is NDM1, New Delhi metallobeta-lactamase 1, first discovered in India but now found worldwide. Every unnecessary dose of antibiotics in humans, animals, or crops gives bacteria another chance to evolve. In hospitals, superbugs like Klebsiella pneumoniae, Acinetobacter baumannii, and Staphylococcus aureus can cause fatal infections with mortality rates above 40%. AMR is a global food chain problem too. Antibiotics are widely used in livestock, poultry, and aquaculture across many countries, including India, China, the USA, and parts of Europe, to prevent disease and promote growth. Resistant bacteria from animals can spread through meat, milk, eggs, and fish, especially if undercooked or poorly handled. Vegetables irrigated with contaminated water or fertilized with animal manure can also carry resistant bacteria. A 2020 review in Nature Food showed that over 2/3 of global antibiotic consumption occurs in farmed animals, making the food chain a major source of AMR spread. The impact varies regionally, but is severe everywhere. In the USA, the CDC estimates 2.8 million antibiotic-resistant infections occur annually, leading to more than 35,000 deaths. Common resistant pathogens include MRSA, multi-drug-resistant E. coli, and Klebsiella. In Europe, the ECDC reports over 35,000 deaths each year due to resistant infections, with Escherichia coli, Klebsiella, and Staphylococcus aureus as major culprits. In China, rapid urbanization and high antibiotic use in humans and agriculture have led to widespread resistance in hospitals and the environment. Studies show that multi-drug-resistant E. coli and Klebsiella pneumoniae are increasingly prevalent, and antibiotic residues are commonly found in farm products. In India, over 300,000 deaths annually are attributed to antibiotic-resistant infections. Children are disproportionately affected, with neonatal infections caused by resistant Klebsiella and Acinetobacter species killing thousands of newborns each year. The Lancet Global Health, 2023. Real-life cases highlight the crisis. In the USA, patients have died from Klebsiella pneumoniae infections resistant to all available antibiotics. In Europe, livestock-associated MRSA has caused deaths in individuals without contact with farms. In India, infants and adults have died from multi-drug resistant pneumonia or urinary tract infections where standard treatments failed. In China, hospitals report increasing numbers of bloodstream infections that do not respond to first-line or even last-resort antibiotics. These examples show that AMR is not a distant threat. It is a present and growing reality. Stopping AMR requires global action. Here are 5 major strategies everyone can follow. First, use antibiotics responsibly. Take them only when prescribed, complete the course, and never self-medicate. Second, improve hygiene and infection control. Wash hands, ensure clean water, practice food safety, and strengthen hospital disinfection protocols. Third, invest in surveillance and diagnostics. Rapid testing and global monitoring can identify resistance trends and guide proper treatment. Fourth, limit antibiotic use in agriculture. Stop using antibiotics for growth promotion and rely on vaccination and clean farming. Fifth, promote awareness, research, and new treatments. Support campaigns educating the public and fund development of new antibiotics, vaccines, and alternatives such as bacteriophage therapy, cell host, and microbe. 2023. If unchecked, AMR could make routine medical procedures, minor injuries, and childbirth deadly once again. The World Health Organization warns that by 2050, resistant infections could kill 1 person every 3 seconds. But it is not too late. By acting responsibly with antibiotics, improving hygiene, choosing safe food, and supporting strong health policies, we can still slow the rise of superbugs. Antimicrobial resistance is not only a medical issue, but a global responsibility. It arises from human behavior, farming practices, and environmental factors, yet it can be addressed with knowledge, vigilance, and action. Antibiotics are one of humanity's greatest discoveries, but they are losing their power. The future depends on what we do today. Save antibiotics. Save lives. Save the future. Antimicrobial resistance, the silent pandemic we created but still have the power to stop.